The silent thief. Understanding and coping with vascular dementia. Vascular dementia is a form of dementia caused by reduced blood flow to the brain, which results in damage to brain cells. It is sometimes referred to as the silent thief because of its gradual onset and its effects on a person's cognitive abilities. Symptoms of vascular dementia can include memory loss, confusion, difficulty with problem solving, and trouble with communication. Coping with vascular dementia can be challenging, both for the person with the condition and their loved ones. However, with an understanding of the condition and proper care, it is possible to make life easier and more fulfilling. In this post, we'll delve into the causes and symptoms of vascular dementia, and share tips for coping with the condition to help you or someone you love manage the challenges and live a fulfilling life. 1. What is vascular dementia? Vascular dementia is a type of dementia that occurs when the blood supply to the brain is reduced or blocked, causing brain cells to die. This reduction in blood flow can be caused by strokes, small vessel disease, or other conditions that affect the blood vessels in the brain. Unlike other types of dementia, such as Alzheimer's, which is caused by the buildup of abnormal proteins in the brain, vascular dementia is caused by a lack of oxygen and nutrients reaching the brain. The symptoms of vascular dementia can vary depending on the area of the brain that is affected, but can include memory loss, confusion, difficulty communicating, problems with vision, and difficulty with movement and coordination. In some cases, the symptoms can develop suddenly after a stroke, while in other cases they can develop gradually over time. It's important to note that vascular dementia is not a normal part of aging, and it can be prevented or delayed by managing the risk factors that contribute to the development of the condition, such as high blood pressure, high cholesterol, diabetes, and smoking. If you or a loved one is experiencing symptoms of vascular dementia, it's important to seek medical attention as soon as possible to get an accurate diagnosis and start treatment. 2. What are the causes of vascular dementia? Vascular dementia is caused by a reduced blood flow to the brain, causing brain cells to die due to lack of nutrients and oxygen. This can happen due to a number of factors, including hypertension, high cholesterol, smoking, and diabetes. Additionally, having a history of stroke or mini-strokes, also known as transient ischemic attacks or TIAs, can increase the risk of developing vascular dementia. The risk factors for vascular dementia can often be prevented or minimized by maintaining a healthy lifestyle. Eating a balanced diet, exercising regularly, and not smoking are all important habits to adopt in order to reduce the risk of developing vascular dementia. It is important to note that while there are some risk factors for vascular dementia that cannot be prevented, such as age and genetics, taking care of one's health can still reduce the likelihood of developing the disease. In some cases, treating the underlying conditions that cause reduced blood flow to the brain, such as high blood pressure and high cholesterol, can also help prevent the onset of vascular dementia. Understanding the causes of vascular dementia is an important step in preventing and managing the disease. 3. Symptoms and diagnosis of vascular dementia. Vascular dementia is a debilitating condition that can be challenging to diagnose. Symptoms can vary depending on the severity and location of the brain damage caused by reduced blood flow to the brain. Some of the more common symptoms include memory loss. Vascular dementia can cause significant memory loss, particularly with recent events or conversations. Difficulty with problem solving. This can manifest in an inability to complete familiar tasks or follow instructions. Difficulty with decision making. Making decisions becomes progressively more challenging, often leading to indecisiveness and confusion. Difficulty concentrating. Individuals with vascular dementia may have difficulty focusing on tasks and find that they lose track of their thoughts. Mood changes. Vascular dementia can also cause mood swings and depression, particularly if the individual is aware of their cognitive decline. Diagnosing vascular dementia often involves a combination of medical history analysis, physical examination, and cognitive assessments. Imaging tests, such as MRI or CT scans, may also be used to identify any damage to the brain caused by reduced blood flow. It's important to note that early diagnosis is vital for managing symptoms and slowing the progression of the condition. If you or a loved one is experiencing any of the symptoms associated with vascular dementia, it's essential to seek medical advice as soon as possible. 4. How vascular dementia is different from other types of dementia. While dementia is a general term that refers to a decline in cognitive function that interferes with daily life, vascular dementia is a specific type of dementia that is caused by damage to the blood vessels that supply the brain. This damage can occur from a stroke, high blood pressure, or other conditions that affect blood flow to the brain. One of the key differences between vascular dementia and other types of dementia, such as Alzheimer's disease, is that the onset of symptoms may be more sudden and pronounced. This is because vascular dementia is often the result of a specific event, such as a stroke, that can cause significant damage to the brain. Another difference is that the symptoms of vascular dementia can vary depending on the location and extent of the damage to the brain. For example, if the damage is primarily in the area of the brain that controls language, the individual may experience difficulty with speech and communication. If the damage is in the area of the brain that controls movement, the individual may experience difficulty with coordination and balance. It's important to note that many individuals with dementia may have a combination of different types, including vascular dementia. Understanding the specific type of dementia an individual is experiencing can help with diagnosis and treatment planning, as well as providing support and resources for both the individual and their caregivers. 5. Understanding the impact of vascular dementia on the brain. Vascular dementia can develop when the brain's blood supply is compromised, leading to a gradual decline in cognitive function. The brain requires a constant supply of oxygen and nutrients, which are delivered by a network of blood vessels. When these vessels become blocked or damaged, the brain can sustain serious injury, leading to cognitive decline and the development of vascular dementia. The impact of vascular dementia on the brain can be devastating. Symptoms can include difficulties with memory, language, and decision-making, as well as problems with coordination and movement. In some cases, individuals may experience changes in personality or behavior, such as becoming more withdrawn or irritable. One of the key challenges in coping with vascular dementia is understanding how the disease progresses and how it affects different areas of the brain. By working closely with medical professionals and developing a personalized treatment plan, individuals with vascular dementia can manage their symptoms and maintain a high quality of life. It's important to note that vascular dementia is preventable in many cases. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and avoiding smoking and excessive alcohol consumption, can help to reduce the risk of developing vascular dementia. Additionally, managing conditions such as high blood pressure and diabetes can also help to prevent the development of vascular dementia. 6. How to care for someone with vascular dementia. Caring for someone with vascular dementia can be a challenging and emotional experience. Providing care for someone with dementia is not just about their physical needs but also their mental and emotional well-being. The following tips can help you provide the best possible care for your loved one with vascular dementia. 1. Learn as much as you can about the condition. Educating yourself about vascular dementia can help you understand your loved one's behavior and enable you to provide the best care possible. 2. Be patient and understanding. People with vascular dementia can become easily frustrated, confused, and agitated. You need to be patient and try to understand their perspective. Avoid being confrontational or critical. 3. Create a daily routine. A consistent daily routine can help your loved one feel more comfortable and secure. This can include meal times, activities, and medication schedules. 4. Encourage social interaction. Social interaction is vital for people with vascular dementia. Encourage your loved one to participate in activities they enjoy and make time for social interaction with friends and family. 5. Ensure their safety. People with vascular dementia can become disoriented and confused. Ensure their environment is safe by removing trip hazards, installing grab bars, and keeping sharp objects out of reach. 6. Take care of your own well-being. Caring for someone with vascular dementia can be emotionally and physically exhausting. Make sure you take care of your own well-being by taking breaks, seeking support, and engaging in activities that you enjoy. Caring for someone with vascular dementia can be a challenging journey, but with patience, understanding, and support, you can help your loved one live a fulfilling life. 7. Medications and treatments available for vascular dementia. Vascular dementia is the second most common type of dementia, and while there are no specific treatments that can cure the disease, there are medications and treatments that can help manage its symptoms and slow its progression. One of the most commonly prescribed drugs for vascular dementia is a group of medications called cholinesterase inhibitors. These drugs are typically used to treat Alzheimer's disease, but they have also been shown to help improve cognitive function in people with vascular dementia. Another drug that is sometimes prescribed is memantine, which can help improve memory, attention, and reasoning skills. In addition to medication, there are also non-drug treatments that can be helpful for people with vascular dementia. These include cognitive stimulation therapy, which involves participating in activities that challenge and stimulate the brain, and reminiscence therapy, which involves talking about past experiences and memories to help improve mood and cognitive function. It's important to note that not all treatments will work for everyone with vascular dementia, and there is no one-size-fits-all approach to managing the disease. It's important to work closely with a healthcare professional to determine the best course of treatment for each individual's specific needs and symptoms. 8. How to maintain quality of life for someone with vascular dementia. Vascular dementia can be a challenging condition not just for the person who has been diagnosed, but also for their families and caregivers. Maintaining the quality of life for someone living with vascular dementia is crucial to ensure they can enjoy their life to the best of their ability. A few tips that can help maintain the quality of life for someone with vascular dementia include: 1. Keeping them engaged. People living with vascular dementia need engagement and stimulation to keep their minds active. Engage them in activities they enjoy doing, such as playing their favorite games, listening to music, or watching their favorite movies. 2. Creating a familiar environment. People with vascular dementia can get confused easily in unfamiliar surroundings. Make sure to make their living space familiar to them with things they recognize and love. 3. Keeping them healthy. A healthy lifestyle, including a healthy diet, regular exercise, and good sleep, can help slow down the progression of vascular dementia. 4. Providing emotional support. People with vascular dementia may feel isolated and lonely. Providing emotional support and being patient with them can help them feel loved and cared for. 5. Seeking professional help. Caregivers and family members should seek professional help from doctors, social workers, and counselors to help them cope with the challenges of caring for someone with vascular dementia. By following these tips, you can help maintain the quality of life for someone with vascular dementia and make their daily lives as enjoyable as possible. 9. Coping strategies for caregivers and family members. Caring for someone with vascular dementia can be a challenging and emotionally draining experience. It is important for caregivers and family members to practice self-care and seek support when necessary. Here are some coping strategies that can help. 1. Seek support. Don't be afraid to ask for help. Caregiving can be overwhelming, and it's okay to seek support from family members, friends, or healthcare professionals. You can also join a support group for caregivers of people with dementia. Support groups provide a safe space to share your experiences, learn from others, and receive emotional support. 2. Practice self-care. Caring for yourself is just as important as caring for your loved one. Make sure to prioritize your own physical and emotional needs. Take breaks when you need to, get enough sleep, eat a healthy diet, and engage in activities that bring you joy and relaxation. 3. Communicate effectively. Communication can be challenging when caring for someone with vascular dementia. It is important to communicate in a clear and simple way. Use visual aids, such as pictures or gestures, to help your loved one understand you. Be patient and avoid arguing or correcting them. 4. Stay organized. Keeping track of appointments, medications, and daily routines can be overwhelming. Create a schedule or checklist to help you stay organized and avoid missing important tasks. 5. Focus on the present. It's easy to get caught up in worries about the future or regrets about the past. Try to focus on the present moment and enjoy the time you have with your loved one. Celebrate small victories and find joy in the little things. Caring for someone with vascular dementia is not easy, but with the right support and coping strategies, you can provide your loved one with the care and compassion they deserve. 10. Tips for preventing vascular dementia. Preventing vascular dementia is possible, and it starts with adopting a healthy lifestyle. Here are some tips you can follow to lower your risk of developing vascular dementia. 1. Exercise regularly. Exercise helps to keep the blood flowing smoothly, thus reducing the risk of heart disease and stroke, which are the primary causes of vascular dementia. 2. Quit smoking. Smoking increases the risk of developing vascular dementia by damaging blood vessels in the brain. 3. Manage your blood pressure. High blood pressure can damage blood vessels in the brain, leading to cognitive decline. 4. Manage your cholesterol levels. High cholesterol levels can lead to the buildup of plaques in the blood vessels, which can cause strokes and cognitive decline. 5. Eat a healthy diet. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help to reduce the risk of heart disease and stroke, which are the primary causes of vascular dementia. 6. Manage your diabetes. Uncontrolled diabetes can damage blood vessels in the brain, leading to cognitive decline. 7. Manage your stress. High levels of stress can raise blood pressure, which can damage blood vessels in the brain and increase the risk of stroke and cognitive decline. By adopting these healthy lifestyle habits, you can reduce your risk of developing vascular dementia and maintain good brain health as you age. We hope that this article has been helpful in providing insight into vascular dementia and how it can affect individuals and their loved ones. Vascular dementia is a difficult disease that can be challenging to manage, but with a better understanding of the condition, its symptoms, and its treatment options, you can help to ensure that you or your loved one receives the best care possible. Remember, seeking help from a professional is always the best course of action if you or someone you know is experiencing symptoms of vascular dementia. Thank you for reading, and please take care of your loved ones in the best possible way.